Thank you, Rob. Well, now that elective surgeries are being performed in the state of Illinois, the University of Chicago is actually leading the way for how those procedures are being scheduled. Doctors there actually came up with a formula that's now being used at hospitals all over the world.
One of the things that we decided from the get-go is actually to move away from this term elective, because when you hear the word elective in an emergency or urgent situation like a pandemic, it creates this perception that it just means that it's optional and it's not necessary. It's a matter of the timing.
When it comes to scheduling these procedures, the University of Chicago came up with a formula. 21 different factors are taken into consideration to decide which surgeries should be done and which should be done first.
As a surgeon, to really think about would a 2-week delay period impact how the disease would progress? Would it make the disease worse, or would it make the surgery more difficult to perform?
While some patients are eager to get their medical treatment started, others are a little more hesitant to go inside a hospital, especially during a time when people are being told to stay home whenever possible. So communication with patients becomes even more important.
We have this scoring system that really does take their safety and their risk into account. They're not just being called in because we want to get their procedure done, but because it's necessary and we think that it's safe and reasonable for them to have it done.
Elective surgeries can still include things that are fairly serious, things like operations in early stage cancer treatment, hernia surgery, even joint replacement.